Good afternoon, everyone. This is Saro Arakelias, your clinical pharmacist. So another pretty interesting drug recently approved by FDA called HERNEXEOS or zongertinib. HERNEXEOS or zongertinib, it's a tablet format medication for treatment of lung cancer. So in a summary format, HERNEXEOS is a kinase inhibitor, as it says over here, indicated for the treatment of adult patients with unresectable or metastatic non-squamous, non-small cell lung cancer. In those whose tumors have HER2 tyrosine kinase domain activations mutations, as detected by FDA approved tests. As I mentioned, it's a tablet format of 60 milligram HERNEXEOS for select patients for a treatment of HERNEXEOS based on the presence of the HER2 tyrosine kinase domain activation mutations. And for those patients, the recommended dose for HERNEXEOS is based on the body weight. Basically, if it's the patient is less than 90 kilogram, the dose is 120 milligram. More than 190 milligram, the dose is 180 milligram. Again, the main medication comes in 60 milligram tablets, as I mentioned, but the dosing is different based on the patient's body weight. Most common side effects seen from HERNEXEOS or zongertinib includes diarrhea, hepatotoxicity, rash, fatigue, and nausea. Some of the drug interactions seen from this drug, let me highlight this for you, includes interactions with strong CYP3A inducers. Avoid concomitant use with strong CYP3A inducers. If concomitant use cannot be avoided, increase HERNEXEOS dose. That way, the patient gets the maximum dose of it. For BCRP substrates, avoid concomitant use with a certain BCRP substrates when where minimal concentration increase may lead to serious adverse reactions. If concomitant use cannot be avoided, monitor patients closely for adverse reactions. So again, there are some major interactions that you should watch out for these patients, especially taking HERNEXEOS or zongertinib tablets for the first time. Again, it's a kinase inhibitor indicated for the adult patients for treatment of non-squamous, non-small cell lung cancer. It's a tablet, as I mentioned, 60 milligram, and dosing goes by the weight. So if the patient is over 90 kilogram, the dose is 120. If the patient is I'm sorry, less than 90 kilogram, the dose is 120. For more than 90 kilogram patients, the dose is 180. And you should be making that with the 60 milligram HERNEXEOS tablets that it comes from the manufacturer. For more detailed information on HERNEXEOS, refer back to the package insert, which will give you more information on the dosing, cautions, precautions on this drug. Hope you enjoyed this video. As always, stay safe and take your medications.